So, ladies and gentlemen, my name is Sharon Whiteman, and it's my great pleasure and privilege to be here with Nicole Bijlsma. And I'm just actually a very sincere apology. As the LDAA, we should have done this years ago. I've heard her speak twice. It was a privilege. And just this last year at the Acids Conference, I thought, why haven't we given a pathway for the people that hang out with us and that we communicate to. So Nicole, apologies, and we're very delighted to have you and very privileged. So for those of you that haven't heard of Nicole Bijlsma is a former naturopath and acupuncturist with 15 years of clinical experience who went on to pioneer the healthy home or building biology movement in Australia after observing very clear links between her patients' illnesses and hazards in their homes. She's the best-selling author of Healthy Home, Healthy Family, founder and CEO of the Australian College of Environmental Studies, the first institution to offer nationally accredited training in building biology, mold, and electromagnetic field assessment. She's widely recognized as a leading authority on how the built environment impacts human health. Over more than 3 decades, Nicole has lectured at tertiary institutions, published in peer-reviewed journals, and become a sought-after media expert on mold, toxicant EMFs with appearances across major TV networks, radio, podcasts, and print, including Body and Soul and Herald Sun. Nicole is committed to bridging the gap between environmental factors and human health and providing clinicians with practical guidance and evidence-based strategies to address the challenges imposed by environmental toxins. She is also dedicated to simplifying the science to enable people to create healthy homes that support their mental and physical well-being. And I think that last sentence is probably the most important for all of us, Nicole. So God bless you. Thank you for being here today.
Thank you so much. Thank you for that introduction. I'm quite humbled by that, and you don't need to apologize for not interviewing me. I'm here now, so better late than never, huh?
Well, it's such a critical pillar of health and people with chronic illness, no matter what other label they may have, this is something that needs to be included and addressed as part of the whole picture. So, and it's not something I personally find easy to grasp. The technical side of things is confusing for me, and I know I'm mold injured, and I just kind of get plowing forward. So maybe I'll take something away that I can do that's easy for my brain to comprehend. So, let's just start first with your story, Nicole. Like, how did you come to be in this space? And I know I said briefly that you saw patterns in your naturopathy practice. So, what led you here?
Two events, really. I was treating two brothers that were 6 from memory, 30 years ago, 6 and 4 from memory, and they had recurrent respiratory tract infections. So the mother saw me as a naturopath as a last resort, and while they were on the herbs, they improved about 50%, but when they finished the herbal mix, their symptoms would come back. One time she asked me to deliver the herbs because she wasn't able to get to the clinic. So I went to this beautiful, affluent home, affluent part of Melbourne. And the moment she opened the door, I could smell mould. And I said, have you got a problem with mould in this house? She goes, oh, yeah, we do. It's in the boys' room. And I said, can I have a look? I had no idea what I was doing. And I just saw this black mould in the corner of the room growing up from a rising damp problem. And I said, without thinking, you've got to move. I said, the timing of this, the boys have lived in this house their whole life. They've both got recurrent respiratory tract infections, averaging 4 courses of antibiotics each a year, which of course obliterates their gut microbiome. And, I think it's not a coincidence. I think you need to move, which I've never been that drastic before. I didn't even know anything about mold. She took my advice on. 6 months later, sold the house and moved across the road. And within 3 months, the kids were free of colds and flus. Like they'd maybe had, 1 or 2 mild ones, but they didn't drag on for weeks and months and require antibiotics. So she was just shocked because she'd been to a lot of respiratory physicians and doctors and etc. And so was I. But at the same time, my husband and I bought our first home in Warrandyte on this beautiful 1/2 acre on the river. And within 2 weeks of moving in, we both developed sleep disturbances and didn't really think anything of it or even correlate it to the house. Within 12 months, I fell pregnant, and then I had 10 miscarriages in this house. And when I started to reflect back on my infertility journey, I'm going, everything went pear-shaped moving into this space. What's going on? And my neighbour said, oh, no one successfully had kids in this house. And it was almost like the light bulb went on, and I literally ran around my house and going, what's going on? And I did everything from the most esoteric. I went to the Aboriginal Society. They said it's an Aboriginal sacred site, and that's not good. And I went, obviously I've tried. Medicine wasn't able to help us. We didn't qualify for IVF because I got pregnant easily. Went to every specialist, and everyone just said keep trying. So I went, oh my God, we're sleeping adjacent to a meter panel. So I started to measure the magnetic fields in the early hours of the morning and noticed that the magnetic fields were really high across our bed as the gas hot water service would kick in. Um, I also had a dowser to come in, and he said there's significant geopathic stress running directly underneath your bed, which is not good. And that correlated with the European wasp nest outside of just near our bedroom window. And he said that's where they tend to go. This is where these types of pests go, right? That's a sign. Here are all the signs on your property that it's an issue in terms of the type of plants, blah, blah, blah. But we were also adjacent to a T intersection. So I started to measure the carbon monoxide levels, and they tripled in the morning of our bedroom, which was closest to the traffic, as it would come from the garage and filter up into the master bedroom, still within Australian standards. And then the peak hour traffic in the afternoon will kick in, and then it was ridiculous, let alone any particulate matter. And then, of course, to top it off, Parks Victoria used to spray across our boundary because we had the boundary across the Yarra River, so they'd be spraying regularly Roundup across our boundary. So it was like there were so many factors. I'm going, this isn't right. So I started to look at what data was available then, and the US EPA had a lot of information on indoor air quality. I thought, I've just spent 8 years at university in acupuncture and naturopathy. Why wasn't I trained in any of this? So I spent 10 years off my own back, to the frustration of my ex at the time, just researching. I'm going, I became a naturopath to get to the cause of the problem. I didn't come here to give a bag full of bioceuticals, which is essentially how I've been trained and how many naturopaths still are trained. Don't get me wrong, changing diet and supplements definitely have a place. There's no doubt about it. But I didn't come here to treat symptoms. I came to get to the cause of the problem. So I realised that I had to do that for myself. And I said to my husband at the time, we need to get out of this bedroom, got to get to the back bedroom because there's something wrong with this room. There's all these factors. So we did. Next time I got pregnant was with twins and successfully had twins. And
Wow.
6 months later moved out of the house because there was too much emotional memories associated with the house, even though it was lovely. And then we moved out, and then I had another child. So I had 3 kids under 3. So shoot me now, they're teenagers.
That's me. I've got 3 kids under 3 and two and twins. Ah,
Changed everything. I literally put my pen down and thought, okay, I'm going to have to retrain myself. And I started listening to my patients. I started taking long histories. And one of the most important questions was, what month of what year did things go pear-shaped for you? That you noticed your health declined? What happened 6 months before that? Career, relationships, any stressors, infections, moving house was the big part of that. And many of my clients were going, yeah, I moved house, or I had a bathroom reno, or we had a water event. And then I started asking long histories and going into my client's home going, that's interesting. You've got a lot of respiratory issues. Again, here's mold. You've got sleep problems. You're sleeping near a meter panel. So I started the college, which became a registered training organisation in 2005. And then I did my PhD on the impact of environmental exposures on human health. And it's damning. Our environment has dramatically changed in the last since the Industrial Revolution, of course, but especially since the 50s with changes in farming practices and spraying pesticides across the globe, which are having massive downstream effects for fertility in wildlife as well as humans, but also, many of the degenerative disorders we're seeing both in children and, of course, in the elderly. It is a catastrophe. It's the perfect storm. And when you have massive changes in the environment where we don't have time for our genes to adapt to that, this is where extinctions happen. This is where most extinctions happen in species, with minor changes in the environment. We've created massive changes in our environment. We're struggling on many levels. And it's the canaries in the mine that are warning us that this is the problem.
Mm.
So people who aren't reacting, they're reacting, but they're not aware of that on a cellular level. So to me, one of the best papers I wrote was interviewing the top environmental medical doctors in Australia and New Zealand. There were 17 of them. And I said, how do you treat the canary in mind? Like, just tell me what tests to do. Most of them couldn't agree on anything. But what they did agree on was that the exposure history is the most important thing that you must do. Take a long exposure history to get the timeline of what's actually going on. So and that takes 90 minutes. They all agreed it takes about 90 minutes. And if they did that, then many of them were concerned they'd get deregistered by
Mm.
APRA because they're spending too much time with the patient. I mean, the system is broken
It
because they're not
is.
trained in chronic disease. They're not trained to get to the cause of the problem.
Mm.
They're actually, trained for acute diseases, no problem. But for chronic diseases, it is a very big issue because we're focusing on diagnostic boxes that are not reflecting what's happening at a cellular level, which is a lot simpler. Medicine is a lot simpler than I think the way it's being treated at the moment, because the focus needs to be on the timeline. It needs to be on the root cause and the triggers, right? So yeah, that was the frustrating thing with me, is trying to unpack that and go back to basics and literally let go of what I've been taught and start listening to my patients. And that's when I started to see a lot of these patterns.
Mm. So that was my next question, but you're sort of covering it. So how would you describe these common patterns in patients that aren't improving as expected? Um, what does that look like, these patterns?
So going back to what year did things go pear-shaped? We're starting to look back 12 months before things went pear-shaped. What was going on in your life? So looking at that history in terms of triggers like infection. Did they get barley belly? Did they get, like, glandular fever actually isn't a big trigger. It's in all of us. 90% of adults have the Epstein-Barr virus. The real question is, why did your immune system not deal with that?
Mm.
So what was the big trigger? And what we've found over a long time now is that mold is blue-green algae, your biotoxins, blue-green algae, and water damaged buildings is a big trigger for immune dysregulation. The problem also is that electromagnetic fields, people have Wi-Fi everywhere, so it's potentiating these biotoxins in the body. So in terms of the triggers, it's the history of what went back. So if people can do a timeline of what was going on in their life when things started to go pear-shaped, they know intuitively they've been forced to go below their neck and go, okay, what is my body
Mm.
as an antenna saying? What am I reacting to? And, the problem is when you start restricting that many nutrients in your diet and go on a restrictive diet, you end up malnourished. And often the diet itself isn't the trigger, it's something much more bigger, such as an infection that the immune system couldn't deal with, or mold, or, plus poor diet. I mean, if you go to processed foods where there's very little fiber, which is the most important thing for your gut microbiome to be able to detox, is to get those really healthy, diverse gut microbiome. And then you add all these chemicals through pesticides, through artificial colors, through preservatives. You've got no resilience to deal with the environment. So a crappy diet with EMFs and mold is the perfect storm. And this is the massive degrade in health. We're living longer, but we're sicker. So we need to start packing that back and starting one layer of the onion at a time to get the health back, because it is possible for most people to be able to get to a point where they can live relatively well in a technological world, I believe. But of course, if it goes on long enough, the neurological damage can be permanent.
Yeah, yeah, absolutely. And so what would you see, how would people, like you listed quite a few factors that could be involved. How do you then narrow it down to what the priority actions might be, or the priority issues?
Yeah, so so what I focus on is the built environment. So I'm looking at, okay, when did you move into the house? How old is the house? When did you move in? Okay, when did your symptoms begin? Like normally I find within 3 months, if the house is significantly water damaged, they start going downhill, right? If not earlier, um, depending on previous exposures. So I'm looking at, are there any water events? Are you aware of any visible mold, condensation, odor? Right. Have you had any roof leaks, drainage problems, or water events which weren't dried within a couple of days? So I'm looking for key events because mold spores are everywhere, including in everyone's house, because they filter in through the windows, doors. Ascospores, basidiospores are natural in the environment. That is normal, right? Normal fungal ecology in a house includes spores. When someone asks me for a professional opinion on their lab results and I see no spores, I know they've had an air filter on, which doesn't reflect it, so it's being manipulated. So it's really important to know that mold is meant to be in your house, the spores, and it's really, in terms of having no mold, that's not true. The problem is once you have liquid water or water vapor for more than 48 hours, 72 hours, you start supporting the growth of mold. And what happens then is the spores start to create hyphae or branch-like filaments, and then they start forming mycelium because the focus of the mold in the house is to decompose your house. They're nature's greatest decomposers. So you have to stop that happening by not giving them what they want. Now, pretty much everything in your house is food for them, and dust, everything. So the pH is right, the temperature is between 15 and 30. That's ideal for mold growth of water damaged buildings. So the key limiting factor is food and moisture. Moisture, it's critical. If you live in a humid environment like Sydney, you can't afford to have any dust because the dust will have the spores in it and it's utilizing the moisture from the air. So it's already growing in that. And I use ATP to show people that. So they've got to be very vigilant with the dust. Clutter, hoarding, a nightmare. It restricts airflow, causes condensation. It's really important to keep it as, neat as possible. Nothing on the floor apart from major furniture items. So if you have a water event, you've got to dry preferably within hours, because you start getting microbial growth within about 48 hours. And then it starts to get into the material. And unlike other microorganisms, fungi has its own kingdom. It's not human, it's not plants, it's sort of between, because it has to release enzymes to digest its food, just like humans. It doesn't photosynthesize like plants. So you've got to keep the house dry. Humidity normally between 40 and 60 is ideal, occasionally up to 70, whatever is normal, but just try and keep it lower. And reduce the dust load, reduce the clutter, and of course to be able to dry as soon as you have a water event. Get onto it as fast as possible. So the things that are the biggest triggers for mold, from my experience, is the mold on the window I don't care about because it's not a risk for health. All that is that it's a single pane window where water vapor has hit a cold surface, condensed. If there's dirt on the window, that's the food. Mold doesn't grow on tiles. It doesn't grow on windows. It doesn't grow on metal because it's non-porous. It grows on porous items and carpets and curtains and textiles. So in terms of risk, you want to make sure that you don't get moisture on those porous, semi-porous surfaces, the drainage problems, roof leaks. Steam cleaning carpets, nightmare. Because if you don't dry within a couple of hours, you're going to have bacterial microbial growth, and they're the worst for CIRS, chronic inflammatory response. So for me, any textiles where you're stepping on it and resuspending the mold, or mold on a curtain, if you see a little bit of mold on a curtain visually, you need to see, it has to be millions of spores per centimetre squared for you to even see it. So if you see a little bit of mold there, you can bet your bottom dollar that most of that curtain is going to be high in mold, because it's what you don't see that is often the trigger for adverse health effects. So a little bit of mold on a curtain means lots of mold that you don't see, which means you're going to have to get a garbage bag, stick it in there, throw it out the window or the nearest door, and just get new curtains up from Spotlight, or blinds would be much better to get that UV through. So it's understanding the risks, and the risks are anything where you're resuspending that mold. So one of the most critical things that creates a healthy home is the vacuum cleaner. The vacuum cleaner needs to have a HEPA filter, because if it doesn't, most of the mold spores settle to the surface. So if you're bringing in, if you've got those ridiculous stick vacuums, and I don't care what brand that is, which overpriced and not very effective as far as I'm concerned, that you're pushing all of that fungal particulate into the system, then it's coming out the air at the back of the unit, right? So, it's really important to get the vacuum cleaner right. It becomes the filter of your house. If you don't get a good filter, your lungs, your body, your kidneys become that filter. So to reduce the load, a really good vacuum cleaner with a really good hospital grade HEPA filter, motorized head if you've got carpets, is much better. And that can significantly reduce the load that a lot of people are exposed to. Yeah.
And so, if someone was starting to try to evaluate their home and to look at what could possibly be the factors, is there a sort of simplified and budget-friendly pathway for people, or maybe separate those two simple steps? So obviously, you've spoken about where risk areas in the home and whether there's been water damage or whatever. If people are in the dark or they don't, or they I know it's a confusing thing. Like some people might not be able to find those things, and some people then still are wanting to investigate what should they do.
That's a great question. And the bad news is some of the worst homes I see, I cannot see or smell mold, neither can the client.
Uh,
But their symptoms indicate that mold could be an issue. So the symptoms, the other thing, the symptoms will guide me whether it's more EMFs, whether it's mold, whether it's more chemical toxicity, or even, methamphetamines or something like that. So the symptoms are critical. In terms of a cheaper way, that's why I wrote the book, Healthy Home, Healthy Family. It's an ebook, it's $30. So it goes through each of those hazards chapter by chapter to look at what could be in my house. And there's also checklists at the back. That's probably the best option to start with, I think. Not for nighttime reading. It's more a reference guide. Can be a little bit depressing at the beginning, but yeah, it definitely will be helpful. I'm also creating a short course for consumers to really help them with the mold side, because a lot of them can be ripped off by people who are testing or remediating and not doing the right thing by the client, especially sometimes these insurance cases can go pear-shaped. So, helping with content like that can be very important. But for me, it's the symptoms. So the symptoms I'd expect with water damaged buildings would be asthma, exacerbation of asthma, allergies, especially hay fever, chronic sinusitis, that's not, you know, uh, treatment is not helping and it's persistent, and upper and lower respiratory tract infections. So these infections it's normal for people to get colds and flu a year, kids, right? So, and adults. So you might get a couple a year. That would be quite normal, but you should get over it quite quickly. When they drag on for weeks or months, that's when there's something going wrong. So for me, recurrent respiratory tract infections such as pharyngitis, tonsillitis, sinusitis, bronchitis that are going on for weeks and months, possibly longer, and not responding to treatment, and they keep coming back. That is a clear sign for me there could be mold. Now, is it in their house? Is it in their car? Is it at their workplace? Is it at their school? These are all possibilities. Or is it another source like gardening mulch or hay because they've got chooks? Hay is loaded in mold, like a nightmare. A lot of people don't tend to think of mold when it comes to livestock, but if you've got CIRS or those symptoms, you can't afford to have chickens because the hay is going to be highly contaminated and there's a lot of microbial growth in there, right? And gardening and mulching, forget it. You're already overloaded. You can't afford any more of that fungal particulate because the system isn't coping. So that's really important to look at that. So the symptoms is important. And then depending on your genetic susceptibility, you can end up going with the fatiguing syndrome. So long-term fatigue that's not alleviated by rest. That's the key. So no matter how much sleep you get, you're always tired. If you're relatively healthy and you sleep, you always feel better. You might not be fixed, but you always feel better, right?
mm.
So that's really key, that long-term fatiguing syndrome. And then, of course, the fibromyalgia, the brain fog, poor concentration, poor memory, missing words mid-sentence. And then, of course, the mental health declines, because mold is really infections that are out of control in the body and a detoxification issue. You've got traffic jams in the liver, which means that your ability to deal with normal chemicals that you were fine with, like your perfumes or your inks, etc., on the newspaper, or any smells, now you can't cope with it. Why? Because there's a traffic jam in the liver in a certain phase pathway, which means that And it's the same pathway, not just for environmental chemicals, it's the same pathway for your neurotransmitters, serotonin, melatonin. So now you're not sleeping at night, you have to sleep during the day, your circadian rhythms are out of whack, you're starting to go to the toilet more regularly because your antidiuretic hormone is impacted. So you're urinating all the time, you're thirsty, but you're not diabetic. That's another signal that it could be biotoxin-related illness. The system is not coping because the detoxification pathway is got the traffic jam. So what needs to be done as the most important thing is to get to what's triggering that, get out of the trigger as fast as possible. And that's the biggest challenge. If they're in housing, social housing, if they're in rentals where the landlord doesn't want to act, they don't want to test, you can't see the mold, but you've been sick since being here, it needs to be tested to quantify. And unfortunately, that's not cheap because the lab costs are expensive. So, but at least we can quantify what's going there, you know what I mean? So it's really important. If the history indicates it's an issue and the the lease is about to go, my rule of thumb is rather than spend 3Gs on testing, break the lease and hopefully find something that is going to be less problematic. For electromagnetic fields, what I'd expect is things like headaches, sleep disturbances, and tinnitus, ringing in the ears. Now, ringing in the ears could be due to many things, like just noise-induced deafness from concerts and all that stuff. But, you know, these are the sort of things that I would look at for EMFs, but as well as the brain fog and the fatigue. Once they become mold sensitive, they're more electrically sensitive. They're more chemically sensitive. So you have to address all of that. And the best place to start is the house because that's the biggest risk because it's where you spend most of your time. So if you can get the house right, it gives you the capacity to be able to recover so that you can deal with those onslaughts when you go out into society and go to the moldy bank and all that sort of things, right? But you need to get the house right to give you that resilience and the diet, of course.
And so, if people are identifying problems in their home? What I know, I can remember at the conference that you had really easy and there's a cost-effective pathway, simple things that they could do to start to remediate and to make their home safer.
Yep. So with mold, it's sometimes, unfortunately, with mold, it might be testing. Put the money into the testing so you quantify what's going on. Getting people to come and fog without quantifying what's going on is where people waste a lot of money because they're just trying to do cheap solutions to complex problems. So it's like going to an oncologist and saying, Doc, I've got a brain tumor, I'm convinced of it, I don't want to be diagnosed, but give me the chemo, right? No one in their right mind would do that. But this is what's happening in the mold industry is they're ringing up remediators to come and fog, which is against the standard of care, which they have to document in writing. This is not best practice. In fact, it'll probably make it worse, right?
Can't
Yeah.
make this stuff
So
up, can you?
yeah, they need to actually find out and quantify with data what's actually going on. A good clinician that takes a thorough history is the start to look at what symptoms you have and where that may be more an issue. Is there a stealth infection like tick-borne illness, massive precursor? Because once you have something like that in a certain genotype, your capacity to deal with a bit of mold in the house dramatically declines. So you're more likely to react because you've got a stealth infection that needs to be addressed, right, as part of the treatment process. So definitely the timing of and symptoms that you have become really important. But for the house, it would be like my book really will go into that chapter by chapter. What does the EMFs look like? So for EMFs, I'm looking at where's the router, the extender, the boosters, the smart meter, the cordless phone. They're the biggest sources, apart from your cell phone, of course. So making sure that your bedroom, get the bedroom right. So have no Wi-Fi enabled devices in your bedroom, have no Wi-Fi enabled devices in adjacent rooms to the bedroom. Ensure that your mattress is not more than 10 years old because of the dust mite. A lot of people have allergies and don't know it. A lot of people's houses I go into, they've got pets, they're allergic to them and they don't know it. So I often say to people with a lot of the respiratory issues, if you've got pets, which is really important for your mental health, I need you to get tested to see if there's an issue for dust mites or pets. and then either get some desensitization or, get rid of the pet, which is probably not going to happen. I'd rather get rid of my kids before I get rid of my boxer dog, to be honest. So you need to then sort out strategies to help you cope with that, right? Get rid of the carpets, get a good vacuum cleaner, get air purifiers. They're massive improvement in healthy homes. By doing those simple steps make a big difference. Clutter and air restriction and dust is an issue. So get a professional organizer to assess and help you declutter in a way that's meaningful, that's not going to be too stressful for you, because that can also impact your health quite significantly.
Even going through clutter, isn't it? It's often gathered mold and dust,
Oh,
and
massive.
it's a
Absolutely.
health adverse opportunity action to take. And so, um, what would you like to see? I don't know if I've covered everything from the personal perspective, but I was wanting to cover what you'd like to see change in the system. So, at healthcare, at government, at policies, in housing, public awareness. What changes would you like to miraculously see happen?
Well, I'd like to see a standard blueprint as to what a healthy home is. We need to quantify what that looks like, because I would say a significant proportion of people aren't living in healthy environments, and often and educate them. This is how you deal with water vapor management. This is why you turn the exhaust fan on, and this is why these are the things, this is how to maintain a house. Like simple principles on how to clean effectively without overloading yourself with toxins. How to actually maintain a house is something that are not, a lot of people don't have an awareness of. They don't understand. It's like servicing and tuning yourself. You have to exercise, you have to have good diet, you have to have good relationships. It's like a house. It needs to be maintained. And I think there needs to be more provisions for the landlord to show that they're actually maintaining properties, like resealing. The roof tiles don't last forever. You might get 50 years, but they have to be resealed every 20 at least, right? Where's the evidence of that? Where is the evidence that the exhaust ventilation, the bathrooms are working adequately and vented to the atmosphere, not just the roof? What's being done to maintain? So I'd like that. I'd like the government to be very clear about this is what healthy houses look like. This is a human right. Now, the challenge with that is social housing is a catastrophe. And if
Mm,
they did that, it'd probably send the country broke, because they don't have the financial means to do this in reality, if I'm really being honest. Like the
yeah.
social housing I've looked at, it's like you can't just put band-aid approaches on it. This is the challenge, because then you get lower socioeconomic classes in the social housing where the kids are sick, and now the capacity to get out of that system through academia has declined because they're now sick and in the house what's causing the problem. And schools where there's a lot of mold, let's face it, there's a lot of mold you find mold in most schools at levels that are concerning, I have no doubt. You
Mm.
know, cleaning and split systems. So I guess in answer to your question, I'd like to see a baseline as to what healthy housing looks like for us to achieve as a basic human right. And that would involve both educating the government, the landlords who choose to rent their properties, and the people, the renters. This is what a healthy home looks like. Because, of course, if the renters don't understand how to deal with water vapor management or aren't in terms of their cleaning
Mm,
process, that can cause problems that they're exposed to, that they've created. No doubt about that.
mm. It's a massive job, isn't it? It's sort of so multifaceted.
Systemic failures across multiple industries. Then we have the insurance industry that are maybe employing, often employing people who are going to save them money. So they'll go to IEPs or hygienists that are undersampling, not identifying or quantifying the problem properly, and then saying there's no issue when there's a significant issue in many of these properties, but they're saving the money. And until it goes to AFCA for the tribunal, nothing's done. So
Yeah.
this is not okay. It needs to be purely independent. I would say having someone on an insurance list is not independent, because they're going to those people because they're often saving the money. That's not independent. It needs to be truly independent, and they need to have basic qualifications. Like most people doing this in the industry have very limited, and in many cases, no formal training to actually do the testing and or the remediating.
That's it. It's a minefield, isn't it? of
Systemic failures across multiple industries. That's what
yeah.
it is.
And so, Nicole, before we do a couple of final things, on a personal level, what's most important in your heart to contribute in this space for people who are suffering from or trying to avoid these illnesses?
I guess looking over the last 30 years of being in this space is realizing that many things need to be done. And I've focused a lot in the last 10 years, especially on educating doctors how to diagnose environmental sensitivities, because it's not in the medical system,
Yeah.
right? In the underpinning course. At the same time, creating an industry of mold testing technicians and building biologists and IEPs to be able to test. So getting the doctors aware of it so they can get to my graduates to actually find the cause and then start the process rolling. Because to me, ultimately getting to the cause of the problem is the most important part of that step, as opposed to, getting into the university system and doing the PhD. I realized that unless your project is going to make money for someone as an outcome, they're not going to put money into causes. They're not going to. I published a randomized controlled trial on the impact of Wi-Fi and sleep, the first real world study ever done on, how a baby monitor impacted healthy adult sleep. And what I found as a building biologist is Wi-Fi causes a lot of sleep problems. But there was no real world study. It's all done in simulated laboratories with a mobile phone, which doesn't reflect real world data. Now, it was nerve wracking because I thought, this is what I see anecdotally. This is what my graduates see. Is this actually real? And what I found over this 4-week randomized control crossover pilot study was that it was statistically significant, both objectively and subjectively. Like their brain waves were impacted, their sleep diaries were significantly impacted. 1/3 of the people had clinical insomnia within 7 nights of a baby monitor on their bedside table. 10 journals rejected it. They would hold my paper for up to 8 months before they rejected it for the most ridiculous reasons, like there weren't enough participants in your study, even though it was statistically significant. And my 3 professors go, they just don't want to publish it. This is the frustrating thing when people go, is there evidence? Evidence-based medicine has kept medicine in the dark because the people who are funding it are often the pharmaceuticals who've got the finances who will shape the question. No, you can shape the question in a way that you're going to get the outcome and manipulate the data. This is the
Yeah.
reality of research. So to do a randomized controlled trial with no funding, which I didn't, I had the funding. I had a scholarship from Jacker Foundation, which was I'm very grateful for that. But, it's difficult. And then when you get the data, you've got journals who've got potentially conflicts of interest with the industry.
Mm.
I'm a dog at a bone. I don't give a shit really what's going on. So I'm a bit of a disruptor because I can see the system is broken and it's failing patients. It's failing the canaries.
Mm.
So there's a lot that needs to be done, but we need to do it from the ground up. That's why books and knowledge and courses become really important to educate people, to give them the capacity to make an informed choice. Because as far as I'm concerned, my ultimate goal is to give people an informed choice so they can make good decisions. If they continue to smoke and they know the adverse health effects, so be it, as long as I don't affect my kids or me, right? When I'm walking past, that's
Mm.
an informed choice. Most people don't make informed choice because they don't realize how broken the system is. And
Yeah.
that's why the revolution has to start from the ground up.
Mm. I think tick-borne illness patients will be hearing you loud and clear. There's a lot of crossover, isn't there? And so, Nicole, I know your website is just a treasure trove of education and steps for people to be able to support themselves in taking action. Is there any advice on how you start to this education pathway via your website? And the other thing I want to highlight is that you have quality recommended facilitators for all of these actions that need to happen on your site as well. So can we just wrap up and help it make it simple for them to go, gee, I don't know anything about this because you've got a encyclopedia of education available.
Yes. Yes. So just tackle things one thing at a time. I guess the main thing where I would start is like, okay, start with the bedroom. That's what I would do at the very beginning. Get rid of all the Wi-Fi enabled devices. Think about, if you can, if you've got old carpets, etc., like that, get someone in to clean that up or remove it. Get an air purifier. Can make them. Air purifiers are so effective that if they're on when we're doing mold testing, we're not going to pick anything up on a cassette. So the vacuum cleaner, the air purifier, and remove the Wi-Fi in the bedroom. can be really helpful. I normally find within 2 weeks of not having Wi-Fi around the bedroom that people's sleep patterns start to get better because it tricks the body into thinking it's daytime. So focus on the sleep. The sleep's critical. At the moment, I'm writing a paper, which I'll put into the next edition of my book, on what actually happens at a cellular level when people are exposed to these environmental triggers, when they go from hormesis down to chronic disease, and where you could be on that path and what needs to be done to reverse it in
Yeah.
order to get
Go
better.
right direction. Yeah.
Yeah. So really it's going back to look at the triggers now. Like emotional stress, like, can be extremely hard on the body. And that's where there's amazing therapies to help with that, to tone down that fight and flight. Because a lot of the time the canaries, even if the causes are gone, the fight and flight's still there and the body's ready to go, right? And it's exhausting. So there are amazing therapies like the Gupta method, etc., that will really help tone that down, that need to be done. It has to be done multifaceted. Unfortunately, some of the best doctors in this space are so busy they're not taking on new patients, and that's the challenge. That's why I wanted to write this new chapter of my book, to help people who may not have the financial reserves or capacity to see these amazing doctors, to actually start getting their head around, okay, this is where I could be at, and these are the sort of things I need to consider with a good naturopath, for example, to get myself back on track.
You just bring me a flashback. In the 90s, I worked with the chronic fatigue clinic in Manly and Sydney with Dr. Mark Donoghue, Joachim Fleur,
Yes.
and Peter Doby. And one of the things we discovered is bringing people into a reverse air controlled environment, reverse pressure. We had a hard time getting them out. That's some of the most sickest, because it was a gradual thing and had the dramatic difference. And also the staff that worked full time in that unit ended up slightly injured, interestingly, getting themselves back out into the world. So they must, had some genetic things going on as well. So, I mean, it's insidious, it's everywhere, it's important, it's vital for well-being and recovery. Nicole, what's in your heart to leave with people with today?
Surround yourself with people that have your back. That would
Yeah.
be it. Emotional support is so important. If you're feeling alone, you don't have anybody, that's, no matter what you do, that's going to be really hard. So get your resources in. And, I think for me, a big part for me, even though I haven't had chronic fatigue syndrome, is actually asking for help is
Mm.
important.
Yeah. And so reach out to us. Well, if it's I'm the one with the best brain on the team, but we'll find someone to assist you and pointing you to information. And we also have a support group every week, where there's a lot of very intelligent people that share their information. So Nicole, God bless you. Thank you for your work and your warrior self. I was felt like I was sitting at the feet of giants listening to you speaking.
Mm.
And I'm so grateful that we were able to give a little snippet of that to our community. So God bless you and thank you.
Thank you so much. Thank you, Sharon.